Now, we know the Delta variant of COVID-19 is different than what medical professionals were dealing with a year ago. And it's actually proven to be more transmissible, even for those who are vaccinated. So if you are, how do you know that your shots are holding up? Are you still as protected against this strain? 10 Investigates' Jennifer Titus dug through the data and asked some experts to make sure you know how to stay safe.
What do we know right now about vaccine efficacy against the Delta variant?
Yeah, so there are a few studies that are coming out, especially from places like Public Health England, where they've been able to do a really good tracking and they have very good vaccination coverage.
The study Dr. Tang is referring to is this one you see here. In it, we found this graph confirming the Pfizer vaccine is still very effective against Delta if you have the second dose.
There is a slight decrease in vaccine effectiveness, real-world effectiveness against the Delta variant compared to previous variants like the Alpha variant, but that decrease is pretty small.
The study shows the vaccine is still 88% effective against the Delta variant.
When it comes to Moderna, are we seeing the same type of numbers, the same sort of effectiveness?
Yeah, so in their earnings call, they didn't put out the exact numbers of which ones were infected with Delta, but what they did show is vaccine effectiveness after second dose.
This is what Moderna put out. Again, not specifically related to the Delta variant, but still an efficacy rate of 92%.
It's still very effective against these variants.
What are we seeing with the Johnson & Johnson?
Yeah, the Johnson & Johnson is one of those. It's a little bit more difficult to study the Johnson & Johnson vaccine because it hasn't been distributed as widely.
10 Investigates did uncover one study done showing the J&J vaccine is 67% effective against the Delta variant.
However, Johnson & Johnson was administered at a time where you likely had higher amounts of variants. And so it's not quite an apples to apples comparison.
We don't have any vaccines that are 100%. The best ones, these mRNA ones, at least in the beginning for the vaccine efficacy in their phase 3 trials, were approaching the top.
For me, the take-home message is all three of these vaccines that we offer in the United States, we're lucky that they offer them because all of them are doing exactly what they were designed to do, is preventing people from ending up getting severely ill and being in the hospital or dying from COVID-19, even the Delta variant.
The experts say, 95% of people in the hospital right now are unvaccinated. Another point both doctors made is that it seems the efficacy has also stayed the same for those who were vaccinated 6 months ago compared to those who got the shot, say, within the past couple of months. And again, we know there have been breakthrough cases for these vaccinated people because, like you heard Dr. Tang say there, vaccines are not 100% effective. Still, breakthrough cases are rare, despite how much you're hearing about them. Now, not all states track them, but taking a deeper dive, the CDC says more than 163 million people in the U.S. had been fully vaccinated against COVID-19 when we first started hearing and seeing these breakthrough cases. Less than a percent of those, less than a percent, have had to be hospitalized, and an even smaller portion of that have died from COVID-19.